What plan do you have to support parents and families who elect to homeschool their children or form neighborhood pods and need coaching and instructional materials to effectively teach their children?
Lopez is no different than any of the other school districts across our country, and especially in our state. We're seeing a lot of families choosing to homeschool their children, and that's understandable. We get it. We're in the middle of a pandemic, the unknowns out there, and so we as a parent myself, we want to protect our kids. And so creating those ways to protect our kids is one of the things we want to do. What Lopez has done to help support those families is we have a strong parent partner program, and we've just increased our enrollment ability with that program. That program really allows the families to stay connected to the school, receive information about what's happening at the school, updates, and just, still provide that learning capability that kids and families need with a little bit of guidance from both the school and from the state.
What can we do for homeschool students or families that decide to put their children into pods? We try to get as creative as possible. We do know that teleschooling doesn't work for everybody. Because teleschooling is built on a schedule. They have the as live as you can get teacher support in a virtual classroom setting, but sometimes the time doesn't work for families. What we heard is that there are some families that they have the daycare, for example, they have grandma or grandpa, or they have connected with family friends to take turns while the others work. But because of that teleschooling time frame wasn't effective. So previously, superintendent here, the one that hired me, actually started the Griffin Bay School years ago, and I think it was a boon for this district. I am a passionate believer in alternative learning experience. That it doesn't have to be just traditional. There are some students that it just doesn't work in the traditional model. But over the years, Griffin Bay School became more of a Griffin Bay High School only, where it served students who maybe were struggling in the traditional high school, and that was it. A year ago, we opened it back up to 3 through 12, and we had a couple of students that came in. And it was primarily just online, and those are good. It served a purpose, but what we did this summer was reimagine and relaunch Griffin Bay School, and we made it K-12. And what the idea is that it could serve all those people who were going to move to homeschool or were already in homeschool, or maybe it would serve those people who just couldn't fit into the teleschooling model. And for example, if you are a first grader, family has a first grade student, and you enroll in Griffin Bay, we would meet with you and develop an educational plan. We would provide the curriculum, and that could be online or it could be in traditional paper and pencil. We'd mail it out to you. Yes, the parent does the delivery. You work with your child, but you meet once a week with a teacher, and there is based on that plan, there's progress monitoring, there's maybe a restructuring of the curriculum, and there's coaching. If there wasn't a pandemic, we would probably open up the walls of our new Griffin Bay building, which is right next to Turnbull Gymnasium once it gets finished, and we would provide some study pods and tutoring time. But for now, what we're really trying to do is give families a chance to help deliver the education in another way. This took off. I did not expect what happened. As of Friday, we had to stop accepting enrollment because we're at 75 students. And we may open that back up to a few more. And that's just K-9. That wasn't the students we already had in the high school. That's 75 new students to this. And I actually had to hire another part-time employee to help with the first grade through fourth grade. And what's happening is that the teachers that are a part of it, they love it because they see the flexibility and they see the individualization that you can give each student. And the families are loving it because of the flexibility. But how it took off was a surprise to me. We have some families that have not been in the public school that are now a part of it because they're able to get the curriculum and get some support. They had homeschooled their families before. We've actually had quite a few students from the other islands that have asked to be a part of Griffin Bay, and we can't accept them yet because we're only allowed to take 10% of our enrollment can be out of district at this time because we're what they call a single district alternative learning school. We're gonna ask to be more than just that because we think it fits a need. We actually had a student a family that believes that they have to leave for a year because of the economy and what their job was, but they did not want to lose contact with our schools because they know they're going to come back. And we couldn't give them access now because their mailing address is going to be somewhere else. We believe we're going to be able to once all the enrollment's set, and we'll fit that person into the 10% confines we have of the how many students we can have out of district. But I'm just saying what I'm trying to point out is that we saw the need for homeschool students and for families that wanted to do it in pods at different times. And we met that need with a flexible program called Griffin Bay, and it grew so fast we didn't expect it. And we've had teachers working for the last 2 weeks, making contacts with those families, setting up plans, explaining the specific structure to it. And I'm excited about it, but I also know we have a huge workload in front of us to make this work effectively.
For Orcas Island School District, how we're going to support our families during this time, those that are homeschooling and in pods as well. The great thing is that as a staff, as a system of Orcas Island School District, we really decided that we needed a orientation for our families. So for the first 2 weeks of school, we're going to bring students and parents in very small groups, following all the health safety protocols, and we're going to spend time face-to-face with our students and our families, and we're going to get off on the right foot for Distance Learning Plus. The second week, we're going to bring those parents and those students back in, and we're going to reinforce what we talked about previously. And that way, we're all on a really good foot going forward September 14th. So it's a slow start for us, but one that is critical as we move forward and we have parents supporting students at home. The other great thing about Orcas Island School District is that we have the OASIS program. The OASIS program is a parent partnership. It's an ALE program that we have. It's one of the top ones in the state. It allows us for those families who really just don't feel comfortable yet doing the distance learning, they can go into OASIS. They can educate their child at home with the support of a certificated teacher and curriculum provided by the district. So we're able to reach our families that way as well. The other great thing about Orcas Island and San Juan County in general is the support of the local community. We've really relied on PTSA and their president, Michelle Rodriguez, to help structure the pods. She's worked with the Fun House and Camper Kyla, who will provide physical spaces for our families. Their students can attend there as well. They are currently hiring more staff who will work closely with the district staff so we can provide the best education possible. We know a lot of our families still have to work during this time. And as an organization, we want to be able to work with other organizations on the island and support the island children. And that's really what it's about. And we're going to get through this together, working together, all the organizations on the island and the community.
Our plan to support families in our school that have opted to homeschool or develop pods this year, more for whether they don't want to be exposed to COVID, or we specifically have families that don't want to have to do Zoom this year, or they do not want their children wearing masks. We have offered the ability for them to have access to the curriculum that we use. The ones that are opting out this year are saying they will be back the year after. So we would love for the students to stay current with our curriculum so they are ready to come right back in. So we have definitely given that access. We have some littles, as we call them, first graders that are choosing to homeschool. And we have offered any of our manipulatives or things you might need for the younger kids so that those parents don't have to go out and purchase all the items needed for their students to learn at home. And they will be buying our curriculum. Specifically, they've all asked to buy our curriculum so that they don't have to go out and do all the research. So if they need support on how to use that curriculum, the teachers are open and available to do that any way they need so that we know that they're effectively able to teach their kids at home.
School held in buildings requires significant space changes, PPE resources, sanitation, COVID testing, access, and other considerations. How well prepared are you to hold school in facilities this fall? Are there viable options for meeting with smaller groups of students?
Knowing that we are going to a virtual learning model after we received the directive from Dr. Frank James, our county health official, it really allowed us to put our time and energy towards that virtual learning model. In that virtual learning model, one of the things that gets kind of addressed but no longer becomes a front runner is the PPE equipment unless we have kids coming here on site. We do have a few identified kids that we do have on site with special needs, and we're following the county's guidelines and CDC guidelines that support just creating that safe and healthy environment for both the student and the staff member and the families that are coming into the building. So if there's a shared space, that cleaning procedure, the safety procedures are all up, and we're working with county health officials on that. In addition, as we kind of look at meeting just those smaller groups of students and addressing some of those options, we want to be mindful of those families that are not able to connect with us a little bit and be able to support them in a way that keeps them connected to the school and preparing us to connect with them. And really what's going to happen is the transition plan, as we start to transition back to a brick and mortar system, it's going to basically have us connect to those families a little bit and just create opportunities where we can bring them in a safe and healthy way that addresses their learning needs and safety concerns that they might have, as well as staff safety concerns.
And we put in safety protocols. We've measured out rooms so that we can have social distancing. We've changed the entire district to a touchless system in all restrooms and sinks. We've ordered the plexiglass dividers like you would see at the grocery stores that are at all public points of contact. And even with all this, we're working with the health department to ensure safety. And we're just at a place where even though we believe what we have in place gives us an opportunity to start movement toward an in-person model again with safety, we're just not ready yet. And I think it's that transmission number that really is the key for us. But I have to say, financially and emotionally, in every which way, the decision to move back to school and ensure safety is a difficult decision to make, and we're not taking it lightly. We just believe the best decision was to go remote to ensure safety of both staff and students at this point.
As far as working with the space and having students on campus and PPE, I have to go back to the work that's been done by the district over the summer. We created work groups. We had a work group for the space issue here on campus with our district facilities director, Larry Metcalf, and his team. They've done a wonderful job. We've walked the spaces with administrators, and really for us, being a small district is an advantage right now. We're utilizing all of the space in our buildings. A goal for us is to have students K through 5 on campus. That's really what we would like to have happen. It's a priority for us. So we've stepped out and we've hired 7 additional paraeducators, and we're looking at splitting our elementary classes into 2 cohort groups. And we're developing classroom space for that. Again, we're having to maximize all the space that we have, and we're utilizing common areas and outside areas. But the goal for us is to have 2 cohort groups for each class and be able to get students back on campus when it's really safe. As far as PPE, as a district, we have joined a purchasing cooperative out of ESD 112, and we have submitted a large order for PPE. We will have it available when students return, and for staff when they return, and they're working in small groups in the meantime. We have that PPE available. Everything from the 30 new hand sanitizing stations, the 7 sinks that we're installing in the hallways of our building so we can have proper hand hygiene throughout the day, to the mask that is needed by visitors who come to our building. The other work group was with our school and district nurse, Cindy Sapp, who's created the health screening forms. Everybody who comes on campus will be required to complete a health screening form along with a temperature check in order so that we can keep all of our students and staff safe.
With school being held this year, and we are working towards being in person to start the school year out, we know it requires significant space changes, PPE resources, sanitation, even COVID testing access. And we are still in the process of being prepared for that. Right now, our class sizes, we are capping at 7 or anywhere from 5 to 8, depending on the size of the classroom we have, so that the desks are spread out. The students will be required to wear masks. The teachers we are getting face shields and masks, mostly for at the front of the classroom, maybe even using the face shield when teaching so the kids can see our mouth, just so they have better understanding of what's being said, and then using the mask when we're anywhere close to a student. We're going to require temperature checks every day with a health questionnaire. We have changed how the students will enter the building. So we have a large assembly area in our building. They will come in and have an assigned seat that's at least 6 feet apart from each other. And then our admin will go around and do temperature checks before they come into the classroom, along with doing a hand washing. We will do lots of hand washing. Anytime they leave the classroom, they will hand wash. When they enter back in the classroom, they will be hand washing. We probably will do a second temperature check somewhere midday, probably more for our younger students who tend to get sick quickly. Like they can come to school healthy, and then by maybe 10 or 11, we can see students begin to really, whether they're getting a temperature or stomach ache, whatever. So we may do a second health temp check midway through our day. We're going to stagger our start times. So each class will have a 10-minute window of coming to school and kind of bringing them through, so we don't have all students entering that large space at the same time. We will also stagger our lunchtime. So basically each class is kind of like their own pod. So if you have 5 to 7 students in a class, they're pretty much with each other all day and not interacting with another grade level. As far as lunch, recess, all of those things will be changed. Where normally they're all together, they will just be with their classroom. What else will we be doing? We're going to just have like markers outside, like lining up. They'll have a space that they know they stand on. We've talked about having a hook outside where they can put their masks on that are separate from each other. So they have a break from wearing their masks, but they won't be near anybody else. All the things that are involved. Basically, if a student has a cough, a runny nose, stomach ache, they're going to be asked to be at home, where typically parents send their kids to school still with like you need to push through being sick. That is not an option this year. There's no pushing through being sick. So with the potential kids missing more school due to having a minor cold or symptoms that aren't COVID related, but we're not going to have them in the classroom, we're trying to figure out how to maybe have Zoom as an option during our normal class day. So if a student has to be home and they're not very sick, but they still want to be involved in the classroom, we're going to try to figure out how to set up where they can still be interactive with the classroom throughout the day. It's going to be a lot more for parents keeping their students home when they're not very sick. You know, we a lot of times have kids come to school with coughs and sore throats, and the parents just medication, give them lots of medication to get through their day. That really won't be an option this year. So those are some of the things we're working on. If we are shut down, I mean, I think there's still potential of having maybe one class a day, maybe once or twice a week being in the classroom and nobody else at the building or something like that. We haven't really talked about that as an option, but I think it may be one we do. We still want to follow all the CDC and health department guidelines. So we're working and talking to the health department often to make sure we're still in following all the correct guidelines so our students and our teachers are safe. We also will not be allowing any volunteers into the school, no adults or outside people coming in that could potentially spread COVID into the classroom. So that will definitely change some of the things on how we work, because we usually have a lot of volunteers coming in, and that will be changing. We also thought about talking to one of the health facilities here about teachers maybe even being tested every couple of weeks in case we happen to be asymptomatic and we wouldn't want to be spreading that to our students. So that may be something we also offer as an option for our teachers.